Hey everyone, it's Aging Grateful. I'm Bobby.
I'm Cedric.
And we are talking about today something that is very dear to our hearts, and we really do take this seriously, and that is medical tourism. And that you should take charge of your health, but take charge of it abroad. Okay, everyone. So today we're going to talk about, a lot of different things. No order to them, but what we do really want to address here, which is one of which is cost of healthcare. And unfortunately, in the United States, we are seeing that healthcare is rising. Right? It's becoming not so affordable to do just simple things, right? Going to get a doctor's appointment, emergency room, some type of procedure. It's becoming costly.
And not only costly, sometimes it takes forever to get these appointments, especially if it's some specialty type of thing.
Absolutely, 100%. Add on the fact that you got health insurance through your employer. Then on top of the health insurance that you're paying every pay period or every month, then you have to go and get a copay, right? And then once you do the copay, there may be deductibles, additional costs of the services outside of what the health insurance covers. So you're looking at quite a bit of money, right? And God forbid, if you go to the doctor or a hospital and you see the real costs that they charge your health insurance provider, and then they negotiate, it can get really pricey. So let's first start off by saying we are not medical experts. No. We're not medical professionals. We're not in the medical field.
Insurance either.
We're not in the health insurance industry or the health insurance field by any means. These are our thoughts. These are things that we are thinking about, especially now that we are at the age that we are and we have worked for companies and employers and had raised children who have had doctor's appointments as well as ourselves. So we're just giving our thoughts. So the first thing we are thinking is for those people who are young, and I pray you're listening to this, and guys, if you have maybe a family member who's in their 20s, maybe early 30s, this might be an option. Now, we're not telling you to get rid of your health insurance from your employer, or if you're an entrepreneur, to get rid of your health insurance. We're not telling you to do that. However, maybe get the bare minimum in health insurance. The bare minimum that you could spend on health insurance, because what we're thinking is whatever the amount or the difference is between the minimum amount and whatever you would have picked, maybe you put that into some type of high yield savings account or some type of investment account to invest the money. And then, when you're getting your yearly checkup or some lab work or things like that, maybe you travel somewhere abroad to get those things done, or maybe small minor procedures to get those done and use that money from the savings or investments. What do you think?
Yeah, it adds up. I think about recently I went to the doctor for, got my yearly exam. And I'm talking US dollars. It cost me about $75 for the doc's appointment, which lasted a good hour and a half. Docs are very thorough. Just everything, just go through everything. Any concerns you have, health-wise, mental health-wise, whatever, they're there to listen and check and do all those type of things. And then got my lab work done, and that cost me $145, something like that. So altogether it was under $300. 8 pages worth of labs. Pretty much any type of lab you can think of, they did. You get the results back the same day.
Which was beautiful.
You got it in your email,
Yes.
They emailed me and the doctor. So basically, for $300,
You had everything?
I had everything. I had everything I needed. And thinking about, like, for me with healthcare through my employer, I'm paying, I know, a little bit more than $450 a month. So 1 month of premiums, I paid less than to go get the whole entire checkup. And just think if I was able to put that money aside,
The rest of that money?
the rest of that money aside, and just
Invest it or save it
Yeah.
over the rest of the 11 months
Yeah.
because you would have used one.
Yeah, and then there's other insurance options like, you know, Safety Wing and some of these other companies that people talk about
Absolutely.
to cover, like, you know, big emergencies, things like that. But like you said, if you do the bare minimum, it could be an option.
Yes, absolutely. And like I said, again, we have to preface this by saying we're not healthcare professionals, we're not health insurance professionals. These are just our thoughts. And realistically, if we had to do it over again with the knowledge that we know, we may not have chosen an option of maybe the main
Yeah,
health
and
insurance.
well,
Major.
it's a little different when you have children too. 'Cause
Right.
You got to think about that. But
If you're single,
if you're single, or if you're at the, you know, now where we're approaching empty nesters and we're pretty healthy, it's definitely an option
Right.
to think about,
Right.
seriously.
so also another thing that we want to talk about is shopping around. So let's say, for instance, you do decide, you know, this might be a good idea to maybe go take a trip to, you know, maybe the Dominican Republic or to Mexico or somewhere that you would like to consider for medical tourism. And you are scouting around in Facebook groups, maybe some people that you know or have heard of. Really, what we are trying to say is don't take people's word for everything. Don't even take our words for everything. You know, if we recommend a doctor or some type of a lab or some other people, do your due diligence, do your research, because what may be you know, specialist that works for me or him doesn't work for you. So you got to work at finding those specialists and those doctors that work for you until you find a team that you are aligned with.
Yeah,
Right?
and the nice thing about that too is you can get prices from these places. It's not like in the U.S. where everything's so secretive with the cost.
Correct.
You can call these specialists. You can get their WhatsApp numbers, and they will tell you exactly how much the stuff is going to cost before they even see you. So you can kind of get an idea, a ballpark of what, you know, what something may cost you.
And shout out to WhatsApp, although they're not sponsoring this video. But WhatsApp is normally what's used primarily abroad. So that's why he mentioned WhatsApp. But yes, we're just saying do your due diligence. They even have, a lot of these specialists have, you know, their reviews and things like that online also. So again, do your research, shop around, and don't just shop for the cheapest, because cheap doesn't necessarily mean good. You know, you want to make sure that you are getting taken care of, because again, you're taking charge of your health.
Yeah, and the groups definitely help, because I remember I was doing some research on maybe possibly getting LASIK. So I started looking in the groups on LASIK, and they tell it all. This doctor does this doctor doesn't do this. You don't want to go to this doctor charges this. And then you could just call those doctors. They put their cards and stuff in the groups and everything, and you can just call them and shop around.
Absolutely. Which leads us to another topic, which is keeping all of your medical records. Keep all of your records. I know in the United States sometimes, you know, with HIPAA and all of this different things, I mean, try to see if you can get all of your medical records. But what we have found being here in Mexico, and we live in Mexico, is that many times in some of these other countries, they give you all of your records. I mean, they give you copies of your labs, scans. I went to an emergency room once, and if you are interested in that story and how that all panned out and costs and all that, last year I did a video on that, so go ahead and we'll put a link to that video. in the description below, but they even gave me my x-rays and I mean copies of what the doctors had did, the orthopedic surgeon, everything. They were thorough.
Yeah, I was about to say, yeah, because here, your health is your health. Your records are your records. So at the end of every doctor's appointment, they give you whatever records or paperwork or x-rays or pictures or whatever they do in the office, it leaves with you.
Yeah, absolutely. As a matter of fact, with the labs, like he was saying, we went and got lab work done. It was early in the morning, and by the late evening, probably about 6 or 7 in the evening, we actually received an email with our lab results back, right? And what happens is that you get a copy of the labs to your email, and the doctor gets a copy of your labs to their emails, and you can actually see that those labs were actually sent to the doctor as well. So you even get that confirmation that the doctor has received your actual results also. So, but we're saying that even in the United States, if you can, get copies of your records, even if it seems like it's a little troublesome. Please try to get copies of your records, because especially if you're going to do something like medical tourism, you want to have those records with you so that the doctors can truly help you, right? Or assist you in making sure that they're doing their best job possible to help you with your healthcare journey.
Yeah, not only that, then you have something to compare it with.
Absolutely. That's another thing, which is beautiful. So, as an example, if, you're dealing with something like diabetes or cholesterol or something like that, it's maybe good to get a second opinion on what our thoughts are in other countries in regards to those numbers, maybe some options, maybe even healthier options for you. So keep that in mind, right?
Yeah.
Also, let's talk about it's never too late to take charge of your health, right?
Pat me like I'm.
Right?
Yeah.
Well, did you want to go?
No, but that doesn't mean I just procrastinated about getting the lab work done because I didn't want to see what the results were, because it's just a man thing.
Oh, it's a man thing? Okay. Well, it is never too late. So, even if you think, you have some health challenges and your doctors may have said, well, this is it, there's nothing else that can be done, you're going to have to take this, or you're going to have to do this procedure, always good to get a second opinion, right? So I'm pretty sure that that's something that you would do, but maybe a second, third, fourth opinion, and maybe those opinions could be outside of your country,
yeah,
right?
Speaking of opinions, one thing I have noticed about the doctors here, at least here in Mexico, is when they're giving their opinions and whatever, it's always been like a diet first, a dietary first, and then medicine. It's not, they don't jump straight into, here's a prescription, go take this. So it's always, they always come at it from another option first, and it has the medicine as the last result. Which is
quite refreshing.
Yeah.
Quite refreshing. And we're encouraging you to just take charge of your health regardless, especially if you feel like it's too late. It's never ever too late. You won't know what you don't know unless you go and get things checked out. If nothing else, just to confirm that what is being told to you is accurate, right? And then you may have some options out there. So just think about that. And also, while getting your exams or your medical items taken care of, like procedures or lab work, don't forget to enjoy the healthy food items in the country that you are visiting. And then we want you to take a step back and take note of how you feel while you're there. See if there's a difference from, where you're coming from. As an example, I've done, and you can go back through our reels or our shorts, and we have our TikTok and Instagram, so some of our reels. And I have done some reels on the fact of eating fruit in Mexico for like the first time, and it's like I had never had fruit before in my life. Like the fruit was so amazing. And let me backtrack. Not that I've ever had in my life, but more so like what I tasted when I was a kid.
Yeah.
It's definitely different, right? Would you say that?
Yeah, that's the common thing you hear from people all the time, and it's not just a fad saying. It's literally your brain goes back to, because you kind of forgotten about it. I promise you have, because the way food has evolved in the U.S. over the years. But as soon as you take a bite, your brain will go back to your kid and the flavor and the taste and everything, and then it's like, man, this is what it used to taste like.
Absolutely.
Every single time.
And that's not just with fruits. That's also with different things
food,
like
yeah.
meats and like the lack of fat in some of the meat is just like interesting, and the taste is definitely different. There's a lot of things that they do not put in the food here that they do put in the United States, or that is banned maybe in certain countries that is good to go in the United States. Some colored dyes I'm not going to mention, but there is some differences, and while you are abroad, enjoy those differences. See how you feel. A lot of, for ourselves and other people that are abroad, losing weight, getting healthier, numbers are changing. Sometimes it's the quality of the air or the water, or just the change of scenery, less stress. So just pay attention to how your body feels in these countries when you do come for medical tourism or coming to get your checkups or lab work. We are big advocates of that, because unfortunately, we are hearing the stories where, people have to make a decision on going to get taken care of, getting their health together. They don't want to, or don't have the means by which to pay to go to an emergency room for their health, because of the costs associated with having things taken care of, or not wanting to go to even something like just a regular checkup, a doctor's appointment, because they don't have the finances whereby to be able to even do that. Go pay the copay.
I honestly didn't, a lot of times didn't do the yearly checkup thing, because I didn't think it was worth it. I mean, you was in there for all of 10 or 15 minutes with the doctor, and then you go get some labs, and it's, a page or two labs, and then you got to fight them to hear the results. You got to go back and make another appointment, pay again. So it was just like,
yeah. Or if your results are great,
yeah,
you still got to pay. Yeah. And so there's a lot of stuff behind the scenes with that. Also, I agree that there are differences, and it is up to you to make the decision of what's best for you. But our hearts go out to those who cannot afford medical care, and we are looking at these things as different options for people to take control of their health. And I know some people are probably thinking, well, if I had money to go to another country, then I could go afford to pay for my medical care. I understand that, but we're throwing these things out here for those people that do have the ability to get health care, but also are not thinking about creative ways in order to save money to be able to do so.
Yeah, that's what I was about to say, because one of the jobs I worked at previously, a lot of the guys there used to go to Nogales and some of the border Mexican towns from Arizona and get all kind of medical stuff done. And I used to be like, why are you guys driving way down there? It's 2-3 hour drive to go get dental work or go get this and that. And they were like, because it's good, it's affordable. I can just go in there and get my stuff done and get out. And now that we're over here, I see exactly what they were talking about. I mean, I'm like, man, they were so way ahead, light years ahead of where we are.
So we're saying that this is not anything new.
Yeah, it's not anything new.
But it's new to us. And if we can get people to really, really think outside the box, help themselves to live better and get quality health care and take care of themselves accordingly, we're going to share it.
Yeah.
We're going to share it. And so with that being said, any more about your lab results?
No, lab results were actually good.
Absolutely. Absolutely.
Cholesterol maybe a little bit high, but they didn't say, oh, go take this medication. It was like, no, but let's see what we can change in your diet and exercise and everything else.
Yeah. So if this was helpful to you, or you felt like this was a really good video, we ask that you like,
comment, subscribe,
and share this video with those who you think might receive some type of benefit from this. We'd appreciate it, and ring that notification bell or hit the notification bell to know when we actually will be making our next video. Another thing we want to mention is that we've hit our 1,000 subscribers. Yes. Thank you. This just lets us know that we are doing right. And it's something that we have wanted to do, and that we will keep bringing this content. And it sounds like you guys want us to continue doing that. And much love to you guys. We thank you so much, each and every one of you, for subscribing and being there for us. And we hope that we are doing the same by providing you the content that we're making. So, with that being said,
deuces.
Deuces.